Good morning, ladies and gentlemen. I'm Lucretia B. Taylor from the second year physiotherapy class, and I will be discussing on the topic today stepping and storation in exercise therapy. Stepping and storation and staging. This is my main topic. So, now we come to the introduction. What is stepping storage? Stepping storage describes purposeful step abduction used to restore or maintain balance when the body center of mass shifts. It is a rampant, often automatic response that reposition, reposition the base of support to prevent fall and support functional mobility. Use stepping stages as both reactive response responding to pre pre pre-totation and pre-active anticipatory training tools. The biomechanics of stepping, center of mass versus base of support. Stepping increases base of support to recapture stability, neatness and step length. Faster pre-tramposition favor short. Quick step, larger displacement require longer or multiple steps. Muscles, synostosis, hips abduction, adductors, and ankle storage. Coordinate to direct the foot. Sensorial impact, vision, vestibular, and and somatorial and someone sensorial case. Sensorial impact vision first. Okay. Determine timing and direction of step. So come to the depth of stepping and stations. Forward step. Most common use to ring forward stability and recover from forward pre-turbation. Backward steps. Backward steps. Critical for posterior perturbation require confidence and insistrate muscles control. Lateral step, extensional for medial-lateral stability, often impair, impair in older adults and those with vestibular defects. Rotation, rotational step, used to redirect movement and avoid obstacles, combine balance with articulated and trunk control. While stepping storage matters in physiotherapy, it is matter in physiotherapy because it reduces fall rates by improving reactive balance, response, enhanced functional mobility, transfer, turns, obstacle, na- obstacle manipulation, promote motor learning and adaptability across contexts, addresses both strength and neuromotor coordination for real world tasks. Property stepping training for patients with recurrent instability or those returning to complex environments. Clinical application neurological condition. Stepping storage are integrated in neurological rehabilitation. 1. Stroke return as lumicor as lumic as lumicor step intertation rate shift and anti-sectoral adjustment. Parkinson's Parkinson's disease focus on using larger steps, amplitude, and freezing storage to overcome freezing. Vestibular disorder emphasizing multisensorial reweighting and graded exposure to pre-thermal vision. Being with support and pre- being with support and treatable pre-thermal visions progress toward unpredictable contact as tolerance improves. Clinical applications: musculoskeletal rehabilitation, stepping storage training support, recovering from lower limb injury and chronic condition. 1. ACL, ACL meniscal rehab, progressive stepping to restore demand, to restore dynamic knee stability and loading control. 2. Hip osteoarthritis, improve lateral stepping and weight transfer to reduce compensatory patterns. 3. Chronic ankle instability, focus on quick direction changes and lateral control to prevent re-injury. Then we'll talk about the designing effect stepping program. Assessment, which is the document baseline, balance gate, step reaction time, and impairment. Personality, personate, and personalization, adjust step, direction, amplitude, due tax, demand, and conjugate load to match goals. Progression: move from support access, independent prevention, base tasks increase speed and upper predictability. Integration: is incorporate functional tasks, steps turn cron and uneven surface for transfer to delay to daily life. Challenges and considerations. So in challenges in consideration, we have the safety first, illness, polio, bar, or spotting for high-risk patients. Then we have the pain and tissue healing and for overloading during early post-ops phases. Then we have the cognitive capacity door taxing may uncover defects, thorough complexity accordingly. Fatigue and cardiovascular tolerance. Monitor intensity and intervals. Document advanced response and adjust progression step can provoke instability if advanced too quickly. So we have the conclusion and futures direction. Stepping storages are a chronic a cornerstone of balance and mobility training. Effective programming combine assessment during progression, task specificity, spasticity, and safety. Imaging error including wearable sensor for step timing, faster reality, pre-trauma, pre-trauma passion, pre-interrogation, and community-based training to improve real-world outcomes. Key takeaway: train directionally, progress, unpredict- unpredictability, and personalized to patient goals. Next step: integrate steps, drills into routine therapy, measure outcome, and interact plan regularly. So I want to take this time